wanted to talk about strategies to overcome back pain. I've been a chiropractor now for 30 years, 15 years in Winnipeg, 10 years in Penticton, and 5 years now in Kelowna. Most of those years I've owned my own practice, had other professionals working for me, but for a few years I did locums, which is taking over practices for chiropractors that were away, more so earlier in my career. Today, I wanted to introduce you to chiropractic and the way we practice in the clinic and talk about different strategies for overcoming your back pain. So, chiropractic is a natural healing method. It works to realign the spine and the posture to improve the circulation, the nerve flow from the brain down the spinal cord out to different areas of the body. For example, down the sciatic nerve to the leg, from the neck area down the arm to the fingers. So there's connections from the spine to different areas of the body and different organs. The philosophy of chiropractic is that it started in 1895 with a person that had a bone out of place in their neck. And when they had that bone out of place, when it happened, it reduced their hearing. And Dr. Palmer was studying the spine, did an adjustment to realign that spot, and it restored the hearing. So there was this cause and effect relationship between the spine, the body parts, and how they functioned. The science behind chiropractic, as the years have gone on and the decades, chiropractic is more and more well-researched, and there's more papers coming out all the time on the effectiveness of chiropractic care for back pain, neck pain, headaches, TMJ, carpal tunnel, and a variety of different conditions related to the alignment of the body and the nervous system. So our main focus is on the spine, but the accessory joints as well, like the shoulders, the hips, the knees, the ankles. Misalignments or subluxations can cause pain and dysfunction. They can cause tight muscles. They can cause swelling and inflammation. And long-term, they can lead to degeneration and breakdown of the joints in that area, something called arthritis. So the role of chiropractic adjustments are to restore the alignment of the body and restore the function so the nerve flow can get through and the body can be strong and healthy again. The benefits of chiropractic adjustments, number one, I would say, is pain relief. It relieves conditions like back pain, neck pain, and headaches. It improves the mobility and flexibility of the area. It enhances nervous system function and overall wellness. And the long-term benefits include preventative care and maintenance for chronic conditions so they don't come back again. The types of chiropractic adjustments and techniques we use in the clinic are manual adjustments or hands-on adjustments to realign the spine, instrument-assisted adjustments, ones like this one called the activator to adjust the bones into a better place. And depending on the condition of the bones, the underlying condition of the patient, we might use a certain technique in a certain area and a different technique in a different area, whatever is going to work the best for the patient to improve the healing process. Always, patient safety and the gentle nature of chiropractic care is the most important thing. So safe, gentle, and effective adjustments is what we want to do each time the patient comes in. Now, integrating chiropractic care into your wellness routine is very important. So coming to the clinic for regular adjustments is important to relieve the nerve pressure, improve the alignment and the flexibility, but then doing things like exercises, stretches, nutritional changes, and even stress management is very important for a good outcome. So as the patient's visits start to spread out, they're not as often, doing things at home to maintain the alignment and the posture, very important. These lifestyle adjustments enhance the effectiveness of chiropractic care and the longevity of the care. There's many case studies that have come out about the outcomes of chiropractic care, and you can see those online. You can always go to our website too. I'll talk about that in a minute, where you can see the reviews that we have.
Thank you so much, Dr. Cary. So let me start by introducing myself. My name is Anna and I'm a nutritionist. I hold a bachelor's degree in nutrition from King's College London, and I'm currently pursuing a diploma in sports nutrition through the International Olympic Committee. My focus areas are gut health, sports nutrition, and plant-based diets. And I'm passionate about making evidence-based nutrition more accessible within my community. I emphasize balance and empowerment in my approach to nutrition, helping people lead healthier lives that fit their unique lifestyles. So let's start by talking about nutrition for inflammation. Inflammation plays a significant role in intensifying pain. When chronic, it can irritate nerves and tissues, contributing to conditions like arthritis and disc herniation. Managing inflammation through diet is one way to alleviate discomfort. So let's talk about anti-inflammatory foods. One of these is omega-3 fatty acids. Omega-3s are essential fats with anti-inflammatory effects. They inhibit pro-inflammatory molecules, particularly prostaglandins, which can drive inflammation and increase chronic pain. Incorporating fatty fish like salmon, mackerel, and sardines 2 to 3 times a week, or flax seeds, chia seeds, and walnuts daily can help you eat adequate amounts of omega-3s. You can try adding a tablespoon of ground flax seeds or chia seeds to your smoothie or oatmeal for an omega-3 boost. Now let's talk about antioxidant-rich foods. Antioxidants like vitamin C, E, and polyphenols help neutralize free radicals, which can cause cellular damage and inflammation. Berries, such as blueberries and strawberries, dark leafy greens like spinach and kale, and nuts like almonds are particularly high in these nutrients. Regular intake has been shown to lower markers of inflammation. Adding a handful of berries to your yogurt or salads, or keeping a small portion of nuts as go-to snacks is a great way to incorporate antioxidant-rich foods into your diet. Now let's move on to talk a little bit about spices. So turmeric has an active compound that is called curcumin, which is a very powerful anti-inflammatory and antioxidant. Curcumin works by blocking a molecule that moves into cells and turns on genes related to inflammation. Turning off these genes is beneficial for reducing chronic inflammation associated with inflammatory conditions. Curcumin has a low natural bioavailability, meaning it's not easily absorbed by the body. Pairing turmeric with black pepper, which contains piperine, can enhance curcumin absorption. Adding a quarter teaspoon of turmeric to soups, along with a dash of black pepper, can help maximize its benefits. But you can also add it to your smoothies, stews, roasted veggies, or rice dishes. This makes it very easy to incorporate into everyday meals. Ginger is another great spice that contains compounds which are anti-inflammatory and pain-relieving. Study shows that ginger can inhibit pro-inflammatory molecules, which contribute to chronic pain and inflammation. This makes it especially beneficial for managing symptoms of osteoarthritis and muscle soreness after exercise. So fresh ginger root or ginger powder can be added to smoothies, soups, stir-fries, and even baked goods. Ginger tea is also a simple and soothing way to incorporate ginger into your daily routine. So let's move on to talk about nutrition for muscle health. Maintaining good muscle health is essential for reducing strain on the back. Strong muscles around the spine provide support and help prevent injury. Nutrition plays a key role in supporting muscle repair and function. So protein is a crucial nutrient for muscles because it is made up of amino acids, which is the building block for muscle tissue as well. You should aim for a moderate intake of high quality protein from lean meats, fish, eggs, dairy, beans, and tofu. For active individuals, a target of 1.2 to 2 grams per kilogram of body weight of protein should be enough to support your daily recovery and muscle maintenance needs. So just to give you some examples of what this could look like, 100 grams of cooked chicken breast will give you about 31 grams of protein, while 100 grams of cooked lentils offers about 9 grams of protein. So there are also key amino acids that we need to pay attention to when eating protein, particularly leucine and lysine. These amino acids play a key role in activating muscle repair and help repair and build muscle tissue. Leucine is found in higher amounts in animal proteins, but soy and quinoa are good plant-based options for you. Consider adding a post-workout snack with at least 20 grams of protein in to help maximize recovery for your muscles. So let's talk about hydration now. Proper hydration is essential for maintaining spinal health, particularly the spinal discs, which need hydration to stay flexible and strong. Dehydration can reduce disc height, leading to increased spinal pain. So how much should we be drinking? The general recommendation is at least 8 glasses of water a day. That's 64 ounces. This should be adjusted based on your activity level and climate. You can also increase your fluid intake by eating hydrating foods such as watermelon, oranges, cucumbers, and celery, or by incorporating herbal teas into your diet as well. These foods and drinks not only hydrate, but also provide additional nutrients that can support your overall health. So finally, let's talk about nutrition for weight management. Excess weight can put undue stress on your spine and the surrounding muscles, which can contribute to pain. Achieving and maintaining a healthy weight can help reduce this strain. So let's talk about some strategies that can help you. Focusing on nutrient-dense food is one of these. So nutrient-dense foods such as whole grains, lean proteins, and fruits and vegetables can help you feel full while providing essential nutrients, which are beneficial when reducing calorie intake. Studies show that a diet high in fiber and low in added sugars can help support healthy body weight. You should aim to create balanced meals that include a protein source, whole grains, and plenty of vegetables to increase fullness and manage your appetite. So portion control is also very important. Learning to recognize appropriate portion sizes is important in controlling calorie intake without feeling deprived. Using smaller plates, paying attention to hunger cues, and eating slowly can help support portion control. You should try to practice the plate method. So half your plate filled with vegetables, a quarter with protein, and a quarter with whole grains. This is a simple visual tool that can help you manage your portions. Also, regular meal timings will help stabilize your blood sugar. Irregular eating patterns can lead to blood sugar fluctuation, resulting in cravings for high-calorie snacks. Consistent meals support stable energy levels and help with portion management. So try to aim to eat every 3 to 4 hours to keep your energy levels steady. And this will help support weight management and help reduce cravings. So thank you so much for listening to this, and I'm going to hand it back to Dr. Cary now.
Getting started with chiropractic care, very easy. Book an appointment, whether you contact our clinic or book online. During the first visit, we'll do a consultation, a thorough history based on the form you filled out. We will do an assessment, including postural pictures, ranges of motion, and then we're going to let you know what the diagnosis is and the treatment plan. How to choose the right chiropractor for your needs. It's important that you're comfortable with your chiropractor. So you can always come in for a consultation if you want to talk to me, or if you're not in our area, I would recommend you go and talk to the chiropractor in your area. Just make sure you're comfortable and it's a good fit for you and your condition. And then take the next step, book that appointment, go in and get your problem dealt with, because if you leave it for too long, it becomes more chronic and harder to treat. If you have any questions Now's a good time to ask. You can type them in the chat. You can leave a comment, or you can DM me. I'd be happy to respond to your comments on social media. We have many success stories in the clinic. Just from the last 5 years of being in Kelowna, you can go to our Google reviews on Tut Street Family Chiropractic. You can go to Rate MDs. You can go to Facebook. Lots of patients have left reviews in Kelowna, previously in Penticton and Winnipeg, where I come from. So lots of reviews over the years on successful chiropractic treatment for different conditions that we've seen, including back pain and neck pain, headaches, and joint issues. Now, why should you choose us for your chiropractic care? Well, number one, we're accepting new patients without a doctor's referral. So we'll do the history, the exam, the diagnosis. We don't need a referral. We do direct billing to insurance, including ICBC. So we bill to 25 different insurance companies like Canada Life, Sun Life, Manulife. And then we also bill to car insurance, ICBC in British Columbia. Personalized care. So each person's unique, and we know that. So we will give you a personalized treatment plan to help you with your condition. And then we do health coaching for clients that can't come to the clinic. Maybe they travel. They've come seasonally just for the summer. They're back in other parts of British Columbia or Canada in the off season. So we want to help them in between appointments with stretches, exercises, and lifestyle changes. So why should you choose us for your health coaching? Well, we have a consulting division at the clinic called True North Coaching Services. We want to introduce you to those coaching services if you don't live in the Kelowna area, so we can guide you to the right chiropractor in your area, or we can help you with some lifestyle changes that you want to make, like better posture, better ranges of motion, an exercise routine, and better nutrition. I wrote a book in 2019 called Back Pain. It was the first book that I wrote, and it is on Amazon. So if you'd like to read that book, you can go over to Amazon, type in Back Pain and my name, Dr. Cary Yurkiw. You'll see the ebook version, paperback, and you'll also notice the audiobook version as well. Now, we've done an update to that book. It's going to be released in January 2025, and it's called The Spine Flex Solution. We'll be talking about back pain and how you can improve your back pain by doing certain things at home, as well as the chiropractic treatments that we do in the clinic. So this book will be kind of a second version or an update to the back pain book that we wrote in 2019. Now, I wouldn't leave your problem. I would take action. So follow us on social media for more tips and updates. Invite people to come to the clinic if you're in the Kelowna area. Encourage them to see a chiropractor if you're not. And if you're in the Kelowna area, you want to come to the clinic for the next 7 days, we're offering you a special promotion, 10% off your initial visit. You have to use code WB10%. When you go to book your appointment, put that in the appointment notes so we know that you've watched this webinar and that you qualify for the 10% off. Our contact information at the clinic is www.tutstreetfamilychiropractic.com. Our email address, info@tutstreetfamilychiropractic.com, and our phone number here, 250-486-0062. I want to thank you for joining me today for this webinar, and we hope to see you soon.